This is Dr. Abel, and today we have the privilege to actually interview not only a past student of the pediatric nutrition course, but a student that unfortunately, but also fortunately, has a beautiful daughter that was born 3 months premature, to tell just a little bit more of her story and her background of what it's like to be a mom going through the NICU process. So of course, this is a course, HUN 6417, the high risk for the newborn intensive care unit. And with us today, we have 3 other students that are going to ask you, Chiara, some questions. Up on the top is Janine Conley. To the right of me is Xavier Pinchal. And then to the bottom is Nicholas Gonzalez. And they're my little team that has been working on ways to just improve the NICU course. But many times students that take this NICU course have never seen a premature baby, have never seen a NICU unit, and really do not comprehend really what it's like. So are you ready? Is there anything you'd like to say, Chiara?
No,
All right.
let's start.
We're ready. So Chiara, can you just tell us a little bit about your pregnancy and the birth of Michaela?
Okay, so when we were trying to conceive, we had some problems conceiving, so we went to a fertility specialist, and he told me that I have a different kind of uterus, I guess. Instead of it being a triangle, usually it was a heart, so it's a bicornuate uterus. And of course, myself, I went to the internet and researched what that meant and what complications I could have. And I saw their premature birth, but I didn't really pay attention to it. I thought, having a miscarriage before, I thought if I got pregnant and I see heartbeat, I'm set, I'm done, I'm gonna have a baby and everything will be okay. So after a year, we got pregnant again, and yeah, everything was okay, even though I had some thyroid issues. I had Hashimoto's disease, and I went up and down with my thyroids, but everything was under control until around the 20-week mark. I started feeling some pain, but I just thought, oh, baby's getting bigger, and it's just what comes with the territory of being pregnant. So I didn't really pay much attention to it. And I remember that we went to the Sawgrass Mall, we started shopping for the baby, and then I had to kind of like take pauses because I was kind of in severe pain, but once again, I just thought it was normal. And then the next day when I woke up, I saw blood, and it wasn't like normal blood. It was, I would say, like diluted blood. And it was all over my bed. It was a lot. And of course, I went into a panic because I thought, oh my God, I lost my baby. And I had bought like an ultrasound little machine, like house machine, because it was a relief to hear the heartbeat, because I couldn't hear the heartbeat with my first baby. I never heard the heartbeat. And so immediately I was crying, and I was trying to find the heartbeat of the baby, and I found it. And then as soon as I found it, I said, we need to go to the emergency room. So we went to the emergency room. We went to an emergency room that didn't even have maternity, but I just put emergency room. And then they did an ultrasound. The lady asked me, or the ultrasound technician asked me, if I was drinking water. And I was like so confused to that question, like, why is she asking me if I drink? Of course I'm drinking water. So then I realized right there that what I was losing was amniotic fluid. So that's why. And there was some issue because there was some blood, but of course it was diluted because it had amniotic fluid in it. And then after that, I went to the OBGYN. And yeah, then she told me that she had some news and that I was gonna have to be in the hospital until I had the baby. And that was around 22 weeks pregnant. So yeah, then I went
So let me just interject real quick. So just to make sure people understand that the term baby is 40 weeks. So you are 8 weeks early, correct?
I don't.
I'm sorry, 18 weeks early. 22 and 18, right?
Oh, yes. Oh,
yes.
completely.
Yes.
Oh,
okay.
And then I know that I was always thinking, okay, I need to get to 24 at least, because it's the 24 is the it's not. I always confuse it with bioavailability, but it's not availability. What is the term? It's oh my God.
You're talking about like for survival, like the chance mortality?
No, it's let me check.
That must have been so scary though, to like go to the ER and then have them tell you like, oh, you can't leave until you have the baby. Like,
yes.
And at 22 weeks, like I have a friend right now who's 22 weeks. I can't even imagine how that must feel to be told that.
Yes, I mean, in that moment, I thought I was gonna lose my baby. So I didn't care about the time that I would spend in the hospital as long as I have a baby.
Yeah, it must have been was it almost like relief to kind of know that you were going to be in the hospital, like being monitored 24/7?
No, it was not a relief. No.
Okay.
I don't know the term. I can't find it, but I know after 24 and after is what usually doctors would try to help a baby that is preterm. Some hospitals do it before. There's been babies that have been saved 21 weeks, 22 weeks in gestational age, but so my mind was getting to 24, and that was my mindset. So I asked my OBGYN what was the chances of me getting to 24 weeks. And she said it was 50-50. So I was completely traumatized because I have the same chances of my baby dying than my baby living. So yes. And then when I went to the hospital, it was the same day that everything happened, so everything was super fast. And they sent me in this PNU, so prenatal unit, and they told me that I had to be in a Trendelenburg position. I don't know if I'm pronouncing it correct, but it's like something like that, where the head is here and the legs are up high, I guess, so that gravity helps not losing more amniotic fluid. And then I asked what I had, because I didn't even ask what I had. And then they said that I had PROM, so premature rupture of membranes. Mm-hmm.
Wow.
So when was it that you ended up giving birth? Did you reach the 24-week mark?
So I gave birth at 27 weeks 1 day. So I was in the hospital for around 5 weeks. They gave me steroids for my baby's lungs and magnesium. I don't know if it was magnesium only, but it contained magnesium for the baby's brain development, so that it has less chances of having brain bleeds, which are common in premature babies. Mm-hmm. And then just a weight gain. It was day by day. So in the hospital, it was day by day, week by week. And towards the end, I started having some contractions. So of course, once your water breaks, your body's gonna think you're already in labor. And there are things that they can do to, not many things they can do with premature rupture of membranes, but antibiotics is one of them, because if you get infected, then it's most likely that you're gonna give birth. So they gave me antibiotics, steroids, magnesium, and then just wait. And then towards the end, since I was also bleeding, I stopped bleeding in the middle of it, and then towards the end I started bleeding again. And they think it was placental abruption. Some of the placenta may be detached from the wall, and I was losing blood that way. And towards the end, one day I woke up, I went to the bathroom, which I wasn't supposed to stand up, but I couldn't go in the bedpan at all. So I didn't even have a bathroom. The bathroom was just right beside my bed. So I went there to pee, and then apparently I don't know, it was completely all blood. And in that moment, in a second, my fiance called the nurse. The nurse came in. She obviously had a face that was not right. Went to get another nurse. The other nurse looked at it, and they told me it was time. So since it was before 28 weeks, my OBGYN thought it was best to do an emergency C-section because of possible, I could crush the skull or something like that. So that to prevent that, it was better an emergency C-section. And it happened in an instant. In an instant, I was already in the OR, and the baby was being taken out of me, just like that.
It's like a very stressful situation. I mean, 5 weeks in the hospital. I imagine, how important was the medical staff? Like, were they feeling to be kind and care about you? And we would have to do that as a future RD, be in that position.
All of the medical staff was great. The neonatologist, of course, we were expecting a preemie baby. So the neonatologist came to talk to me once I was admitted. I didn't want to talk to them anymore after that because I wanted to talk. I just didn't want to know the chances anymore. I just wanted to go day by day type of thing. And but they had a positive view of the situation. They didn't say that I was going to be in trouble or the baby was going to be in trouble. My OBGYN was also super supportive. All the nurses were extremely supportive, always telling me positive stories. And sadly, the only person that I thought was not that supportive was the RD. She actually came a couple of times to see me in the prenatal unit, and she told me that she needed to weigh me, and the scale in the bed didn't work. So she wanted me to stand up and to go to a scale, and I didn't really want to because that meant me losing water. And, I understood that weight gain is important to see, baby. But in that moment, I didn't really care about that. I just cared about me keeping as much amniotic fluid as I could inside and not going to see my weight, So the couple of times that she came in to suggest that I go on to the scale, I just said no, and I just didn't want to see her, to be honest. I didn't even shower for 5 weeks, so I didn't want to. I don't know. That was the only person, but all of the other people, and it's sad, but
that's ironic that it was the dietitian. So how did you feel? Like, was it her bedside manner? Like, did she explain to you why the importance of it, or when you told her no, like, how did she react, and how did that make you feel?
She said, it's right here. You're not gonna be walking far, but I didn't want to stand up. That was the thing. Even if it's two steps there, it's just I don't want to stand up. So every time that I stood up, I felt liquid coming out. So I just didn't want to do it. So whenever I saw her entering the room, I was like, oh no, I know what you're going to ask. And you know what I'm going to say.
Mhm.
So yes.
When you, so after you gave birth, like when you came out of the C-section,
Mhm.
when were you able to see your baby? When were you able to see Michaela, and how, can you describe like the first time you saw her after you gave birth?
When I gave birth, I just heard her cry, which was great. And then I didn't see her at all. I just saw a group of people because I could see where they were gonna put her, and I thought I was gonna be able to see the baby because it was right beside me, but it was an army of people for one baby. So it was not only one neonatologist, I think more than one neonatologist and a bunch of NICU nurses and the respiratory team, and not sure if they were the only ones, but it was an army of people. So it was all a lot of people surrounding her. I couldn't see her at all. Then they took her, and the neonatologist, one of them, explained to me what happened, and which gave me relief that she was breathing on her own, but some assistance. And then when they took me to the recovery room, I was there for an hour. And then once they took me to the room that I was going to be for 4 days, I think, after the C-section, the only way I could see her was through an iPad. So the NICU nurses had an iPad, and we FaceTimed. And that's when I saw her with all the tubes and in her little isolate. So yeah, that's when I met my baby.
Oh my goodness. How hard, that must have been so hard for you.
Well, the hardest part was actually seeing her in person, because that's when I realized, oh my God, that baby is not supposed to be outside. It's not supposed to. It's just too weak, too delicate, too red, no skin, skin layers.
Oh my goodness. If you could describe like how big she was, like.
She was 2 pounds 6 ounces. I don't know if I can describe how big she was, but yeah, she was 2 pounds 6 ounces.
Oh my God.
Mm-hmm.
Precious.
Yes.
And so then how long was it until you were able to actually like touch her?
To touch her, they told me, I was completely scared to touch her, to be honest. So I wasn't pressuring anybody to touch my baby. I was just looking at her, and but they told me I could touch her. They just told me how to touch her. It needed to be kind of like giving her a little bit of pressure, like containing her. I don't know how to, since she's used to a uterus, and now she's out there, and so I could touch her little head, but I had to. It wasn't a natural touch. It was not like a touch like that. It was more of a touch like this, and I could touch her hand, but as soon as you touch them, they don't like it. They don't like to be touched. They're not used to being touched. So I didn't really want to touch her if she disliked being touched. But yes. So, and then I could do kangaroo after, I think it was after maybe a week of her being born, because she had a neuroprotection thing going on where they put like a pillow around her head so that she doesn't do movements to prevent brain bleeds.
Oh, okay.
So until that, they call it neurobundle, went off of her, then I could do kangaroo care, which is skin to skin. And then, of course, the first day that I could do that, I did it.
Chiara, 2 things is that Michaela, and do you need to go get her? You can bring her out here if you want. And
okay.
Second of all, when you come back, could you tell the students what kangaroo, what that means?
Okay, just 1 second.
Yeah, that'll be fun.
We get to see her.
How old is she now? Do you know?
This was like 2 almost, right?
no, no,
Or no?
I think she corrects to 7 months.
Oh my goodness.
Wow.
Chiara, how old is she right now?
She's 11 months, so 8 corrected.
Okay, I was,
8 corrected.
yeah.
Look at her. Oh my
Hi.
God.
Hi, sweetheart. Oh, you're so cute. Hello. All right.
So kangaroo care is when you do skin to skin with all the machines and everything they're using in the NICU, and you put them on your bare chest. That's gonna
And
happen.
did they use one of those weightless chairs? They kind of look like lawn chairs.
Yes,
Yes, okay.
you're kind of a little bit. Oh, she's not gonna want this.
Okay. Hi, Michaela.
Say hi.
Yeah.
Oh my goodness, she's so
She's
big.
adorable.
I
Yeah.
can't believe that she was 2 pounds.
Yeah.
Oh,
She can't either.
either.
No, she doesn't want to be here. Wait 1 second.
All right.
Uh-oh.
Wait, I don't want to ask her. She mentioned that she was 2 pounds 6 ounces, but she kept on going like this. Kira,
Mhm.
I have a question. You said that when she was born, she was 2 pounds 6 ounces,
Yes.
and you kept on saying that when you were touching her, you had to go like this.
Uh-huh.
How, if you could describe how, I guess, like big or like large on size she was?
She was probably like this, maybe a little bit more than my hand, I guess. If you
Okay.
stretched her a little bit more than my hand, but she was really little. And you do like that just to like make them feel safe, I guess. But it was really little, especially because they're still, like in this position. They tried to position them like all flexed, like
Was
in the
that,
uterus.
Like they were still in the womb.
Mm-hmm.
yeah, was that was she in the intubation, the incubation tube?
Incubator, yeah.
Yeah.
Yes. Uh-huh. So you could do through the little holes on the side, or you could also uncover it, and it still brings them the warmth that they need. It's just you can choose, but I always kept the thing on top because whatever I can do.
Close.
They do recognize both mom and dad's voice. And there's been some really positive research that all that noise and mechanical stuff, that playing soft music really helps these babies. We usually actually have either a violinist or a piano player come in and play in the NICU when I work there.
Yes, I've seen music therapy for premature babies. I wasn't that, my hospital didn't offer that though. Mm-hmm.
Wow. Oh, Kira, what about feeding her? So when were you, how was she fed initially when she was born, and were you able to pump breast milk, and if so, how did you go about that? And how was that interaction with her?
Mm-hmm. When she was born, I went into the mindset that I needed to pump. So before, it was the mindset that I need to keep her inside me as long as I can, and then automatically shifted to I need to pump. So the hospital gives you their pump and your pump parts, and that same night I was already pumping, and the lactation consultant comes and speaks to you about how many times you should be doing, how much you should be providing for your baby. They call you or meet up with you every week to see how your pumping goes, or you can just call them and if you have a question. I had around 3 meetups with them while I was recovering to make sure I was doing it correctly, or to make sure I was fitted correctly and everything. My pumping story is not great because I got very sore very quickly. I guess I went overboard with the pumping because I thought that's the only thing right now I can do for my baby. So might as well succeed and be amazing at it. And I think I may have put too much of like the pressure in the pump or something. And then I completely destroyed them. And it was hard because I still needed to pump with, wounds and cuts and scrapes that I had done with the pump. And to get to that amount of ounces I needed to pump by this week and by the other week and by the other week. So she did drink my milk, or when not drink, but she was fed through the tube my milk, my colostrum, and then the milk that I produced, little by little in increments. Depending on how she was tolerating it, they would go up until they finally went up all the way to full feeds through the tube.
What type of tube was it that they had?
It was first they do oral gastric, and then because she has respiratory support, and then once they can do nasogastric, they change to nasogastric. But first, she would get her nutrients by TPN. Mm-hmm.
Well, first she was on TPN, and then go ahead, Dr.
Chiara, can you just speak to what it was like being away from Michaela to go pump? Like you weren't able to pump right at the bedside. You had to go somewhere to pump. Is that correct?
You can't pump at the bedside. They recommend you pump at the bedside because seeing your baby could help the production of milk. So plenty of times I pumped in the bedside, but also I didn't have my NICU, like it's my NICU. The NICU that Michaela was part of, they didn't have a room per NICU baby. So it was one big room with a bunch of beds. So they just provided like a cover up, I guess. And, when pumping, I would try to massage and to get more milk, as much milk as possible. So it was a little bit hard because I didn't want like people seeing me like doing my massage. And so I felt a little bit uncomfortable there because there were gaps, and if she has a Brady, nurse needs to come in and stimulate my baby and get her heart rate back up again. So there were a lot of, if a machine starts making a noise because it needs to it needs more of the feed or something like that, there were a lot of people go in and out. So we had also a pumping room, and I think I pumped the most there. So it has snacks and a TV, and you're comfortable, and you can even read things about March of Dimes and different strategies. So I pumped there, and then you just give it to the NICU nurse, and they put a little identification thing, and then that's it. They give it to your baby.
I see.
Mm-hmm.
It sounds like such an experience.
Yeah.
My goodness.
Chiara, how would you describe from the 22-week all the way to now your experience in correcting for prematurity?
It's been hard because people don't correct. They don't know how to correct for prematurity. I've noticed. It's also a little bit, whenever people ask you, oh, how old is she? She doesn't look like a 1-year-old, but she's going to be 1 soon. So it's like, oh, she's this age, but really she's supposed to be, 8 months or 9 months. And so, and with doctors, and my pediatrician was from the get-go told me you cannot, every single development, every single, getting to feed her solid foods and everything needs to be through her corrected age. But I've noticed that some other doctors. For example, I had an experience with a gastroenterologist. He asked me at, I think it was 6 months actual age, so she was 3 months corrected, if I was already feeding her solid foods. And of course my first reaction was like, no, she's 3 months corrected, I shouldn't be feeding her solid foods. And he was amazed that, like, why aren't you feeding, she's 6 months already. So even I got weak benefits because of low birth weight. Even then, they've helped me with formula, because at the end they changed her to formula. And even though I'm so grateful that they've been able to help us with the formula, I wish they also took into account corrected age instead of actual age, because by 6 months they were already offering me less formula and more foods, purees and whatnot. So I wasn't there yet. And when I tried to tell them, hey, but my baby was premature, and right now she should be eating like a 3-month-old, not like a 6-month-old, they just, it's not what they can give me. So
Wow. So even Wick was using the chronological age and not the corrected age?
yes. Mm-hmm.
Wow, that's crazy.
I just want to reinforce what Chiara's saying. It is so important to correct for prematurity, because developmentally, these babies are not the same. And depending how much longer they should have been in the womb, as she mentioned already, the baby was born without skin. That's an outside organ, but the internal organs are very much immature, especially the brain. So none of the developmental, so if we were to feed a baby at a younger age, especially a very premature baby, that baby actually could choke. There'd be other concerns because they're not developmentally ready. So this is a very, very important issue, is to correct for prematurity, so that we have the right mindset of where this child is at developmentally.
Mm-hmm.
Chiara, does Micaela, does she have like an interdisciplinary team that she has to see because she was born premature? Like, is she in speech, or do you think, like, because I know there's other programs like the early intervention program that is specifically for like babies who were premature, and to like get them developed, like to assess the developmental milestones?
Yes, we did that. She also qualified because of birth weight. We did that, and they did recommend occupational therapy and physical therapy. She's still in both. She also went to speech therapy, just because once I took her home, she started to have a lot of trouble taking the bottle, and she didn't really want anything in her mouth, and it was very, very, very difficult to feed. So we did speech therapy and occupational therapy and physical therapy. She's still doing. Mm-hmm.
Let me ask you too, do you have any more interactions with a registered dietitian, like a different one, or even like the same one? Did you have any more interactions with her after your experience with her in the hospital, or even just another RD?
No.
Okay.
No. I just saw, we had a bunch of other doctors that we had to see, like pulmonologist and eye doctor and gastroenterologist, and bunch of doctors plus therapies. But no, I haven't had any RD appointments or anything like that.
Chiara, when Micaela was in the NICU, how long was she in the NICU before you got to bring her home? And did when they rounded, was there ever an RD that rounded in the NICU when they like that went over her growth or her nutritional intake at all?
She was in the NICU for 87 days, so almost until she should have been born.
That's great.
And then there was no RD in that NICU. no RD for NICUs. Only the RD that I saw prior to having her. That's the only
Okay.
RD. The rest, it was just the doctors. And yes.
Okay.
Mm-hmm.
Where were you while she was in the NICU? Like, were you also in the hospital the whole time, the whole 3-month period? Or were
No.
you like back and forth from home?
Yes, back and forth. Mm-hmm.
Uh,
So I would live in the NICU, but then I would have to go to my house to sleep and then come back again.
I have a question. By the experience that you had, and for somebody taking this class, what advice or what would you recommend them to, like, not just like remember, but like also apply later on, that you would think that you will find meaningful?
I would say mostly to take into account the mother's guilt. I don't know if motherhood comes with it. I don't know if it's a given, but I had such guilt about this whole situation. I still do. I still have guilt about it. Sometimes I think, well, maybe if I didn't do this, I could have avoided that. And if I didn't do that, I could have avoided this. So definitely be empathetic in that sense. It's most likely that the mom is suffering horribly. Even with like pumping, and one moment like I thought I wanted to give up. So even with that, I had guilt. I had guilt with the fact that my baby was premature. I had so much guilt. So I feel that RDs need to have that into consideration. And also, when I was talking to Dr. Abel, she pointed out something super important, which was the discharge talk that you have with the mom and the dad, I guess, of the baby. In that moment, you're not thinking about anything but how crazy it's gonna be to take your baby home. And I swear I didn't have an RD that talked to me, but the doctors, not the doctors, but the NICU nurses talk to you and kind of like test you to see if you know what's the temperature and all these things. And I did not pay attention at all. So in that moment, your life is going to change forever. You're extremely worried about how it's going to be when you take your baby home. You've gone through, it is really a trauma to have a baby in the NICU, because you've seen them in their weakest and you're scared and you're not thinking about anything but, oh my God, I'm going to take this fragile baby home, and how am I going to do? And if this happens, and if this other thing happens. So I did not pay attention to any of that. And I think that's when empathy comes again, for RDs to be super empathetic about what they're going through. And like Dr. Abel suggested, that she would do this discharge after a week of the baby being discharged, and that would have helped me so much if somebody called me and say, okay, so let's do, how are you doing? Do you have any question for me now that you've settled in your new life? And I think that would be important. Even with diagnosis, like I had some trouble with her gaining weight after she was outside of the NICU, and I didn't want the doctor to think that I wasn't doing a good job. I was trying my best. It's just wasn't working. So I just needed somebody, instead of pointing fingers and you should be doing this, you should be doing that, just be empathetic and be comprehensive that I'm trying my best. I'm dying here for my baby to gain weight, and it's not working out. So it's not really always the fact that the moms aren't responsible or aren't caring enough for their babies. Is also I'm doing as much as I can, just please help me.
Like
So,
almost reassuring, like to reassure you that you're on the right path, and like, is that what you're saying? Yeah, to get, instead of, did you feel like the doctors were like guilt tripping you?
Sometimes I would feel that way. Sometimes maybe even then, like, she shouldn't be here. Those comments that, yeah, she shouldn't be here right now, but I'm sorry.
From working in the NICU for a little over 10 years, just from the other side of the perspective as a healthcare provider, you can lose sight of humanity. It can literally be a job where you're going in and you have a list of things that you need to accomplish and do as your job. And that's why I really try to teach from scenarios through all of the pediatric courses. And I have all of these questions so that you can interact and understand it from the perspective of the patient. And because without the patient buy-in, the mom or the child, they're going to walk away and not be able to do what your plan is. And so that connection of I call it humanity, but just empathy, the ability to understand from the patient's point of view. And I think that you brought out so many excellent points about compassion and empathy that if we could even spend one day in your life, we would have a different assessment to what it's like. It's very, very important. The sleep deprivation, the fear of the unknown, all that you've been through with this little one. And then, the last thing you need is someone's judgment. And even their knowledge can be judgment. That's what I have a very hard time explaining to students, that even though your knowledge is correct, it can be felt like judgment without the empathy first.
Yes.
Chiara, I just want to say that I think you are one of the strongest mothers I have ever met. And
thank you so much.
I'm so happy that your daughter she's beautiful and she looks healthy, and that both of you and and your fiance or husband now, I'm not sure, have gone through so much, and to see the positive outcome is really reassuring. And knowing that it's not like that for everybody else. I think we've all gotten, thank you so much for even doing this interview. I think it must have been really hard for you to relive that experience with us. Cause I know I got teary-eyed just hearing you talk about it. So I can't imagine actually going through that. I mean, just last week I was scared I was going to lose my dog, and I felt that way. So I can't even imagine, your own child. So thank you so much for doing this for us. And I think that everyone who sees this and is taking the NICU course, I think it's going to be very valuable for them to really understand the practice of it, and having that experience with a mom who's going through it all. I think will bring a big picture and put it into perspective for us. So thank you.
Thank you. I'm glad I did it. It always brings me back, and then I feel thankful that even though I had a premature baby, she's healthy and she's here with us. So
yeah.
Yes.
Wow. Thank you very much. We really appreciate it all. And thank you, Xavier, Nick, and Janine. It was helpful having students here to ask some of the questions as well. So we are going to sign off, and we are very grateful for this time with you, Chiara. And thank you for bringing the baby out too. That was
Yes, kisses to Micaela.
Yeah.
Thank you so much.
All right. Bye-bye.
All right, bye.
Bye.